times when I see Japanese doctors walking through university hospitals in America and feel uncomfortable stares directed at them. Today's protagonist is an American nurse with strong confidence in America. When a Japanese doctor appeared in an emergency situation, she, despite her role as a nurse, ignored the doctor. Even when questioned by those around her if she was right, she remained composed. However, it is said that soon after, she found herself in a situation where she had to drop her skirt in front of a Japanese man, discarding all her pride. What on earth happened? Subscribing and liking will be a great source of encouragement. My name is Marison Brooks. I am a nurse working in the gynecology department at New York Medical Center. I graduated at the top of my class from Stanford Nursing University and was praised by professors since my undergraduate days as a born nurse. I was scouted by this hospital immediately after graduation, and it's been 3 years, but no one has ever doubted my abilities. The readmission rate of patients I've handled has been 30% lower than the department average, and I've consistently ranked in the top 5% in patient satisfaction surveys. My abilities have been particularly recognized in the management of complex surgeries and the care of elderly patients. Even the department chief introduced me as the pride of our hospital at conferences I attended. With these achievements accumulating, I naturally began to see myself as a representative of the excellence of the American healthcare system. However, to be honest, I had one problem. It was my perspective on healthcare professionals from foreign countries. Especially when I saw Asian doctors or nurses, I would unconsciously frown and often doubt their judgment and abilities. This way of thinking first arose about a year ago. A resident from India miscalculated a patient's medication dosage, nearly leading to a major accident. From that point on, I came to believe that one must receive an American education. Of course, American doctors also make mistakes, but for some reason, only the mistakes of foreign healthcare professionals remained in my memory for a long time. Even when eating in the cafeteria, I always sat only with my American colleagues. When I saw Asian healthcare professionals gathering among themselves, I thought, they only gather with their own kind. I felt even more uncomfortable when I saw them conversing in their native languages. I thought, this is America. Why aren't they speaking English? We had nurses Maria from the Philippines and Priya from India. Maria was a veteran with 20 years of experience, but I would look at her with suspicion every time she checked a patient's chart, wondering if she was really looking at it properly. The same was true when Priya was preparing medication. I often double-checked from behind, thinking, what if she makes a mistake with the dosage? Every time they made a mistake, I thought to myself, as expected, it's because they didn't receive local education. However, when I myself made a mistake, I would dismiss it as a mistake that anyone could make. Even while applying such double standards, I didn't think it was discrimination. I simply justified it as a realistic concern. It was even worse when I looked at Dr. Kimura, a resident from Japan. Every time he explained a patient's condition, I would look away or make an unpleasant expression. I rationalized to myself that patients also found it unpleasant because his English pronunciation wasn't perfect. In fact, Dr. Kimura was highly skilled. Even when conversing with colleagues at the nurses' station, I often said things like, "Aren't there too many foreign doctors lately? The patients are anxious." Other American nurses often agreed with my words. As these conversations piled up, I became more and more convinced. One Monday morning, a new doctor arrived at our ward. He was a Japanese emergency medicine specialist named Kenji Tanaka. He was about 185 centimeters tall, with broad shoulders, and from the first impression, voice was low and calm, but it was difficult to read his emotions. When he received the ward introduction, he just nodded and answered curtly, "No," when asked if he had any questions. Then he immediately got to work. The moment I saw him, I felt inwardly displeased, thinking, another outsider has come. Another Asian doctor. This time it's Japanese. Let's see how long he lasts. I was particularly bothered by his quiet personality. American healthcare professionals are usually active and emphasize communication, but he was the opposite. For the first week, I carefully observed his every action. He arrived at exactly 7 a.m. and stayed at the hospital until 9 p.m. He ate lunch alone in the cafeteria and didn't try to mingle with other doctors. During rounds, he only spoke what was necessary and did not engage in any jokes or small talk. What was even stranger was his work style. While other doctors usually just gave instructions to nurses, he directly went to the patient's bedside to check their condition. He even tucked in patients and refilled their water cups. I thought to myself, why is a doctor doing that? Is he trying to take away the nurses' jobs? After the first week, I had been observing his work style. To be precise, I was looking for his mistakes. But strangely, he had no flaws. He carefully checked patient charts and was cautious with prescriptions. Still, I thought to myself, it's just for show. Then, one Saturday night, I entered the emergency room with Kenji Tanaka. I wasn't really looking forward to working with him, but it was unavoidable due to the schedule. Weekend nights in the emergency room are always unpredictable. We had to be prepared for all sorts of situations, from intoxicated patients to traffic accident victims and patients in sudden cardiac arrest. It was relatively quiet until 10 p.m. There were only a few minor injuries and patients with abdominal pain. Dr. Kenji Tanaka remained quiet as usual, but he examined each patient very carefully. As I watched him, I thought to myself, he's inflexible, just like many Asians. However, around 11:15 p.m., the emergency room suddenly became tense. Patient with difficulty breathing, ETA 3 minutes. The emergency dispatch radio blared. I immediately prepared the emergency treatment room. I checked the oxygen supply and prepared the equipment to secure an IV line. Dr. Kenji Tanaka calmly put on his gown and gloves. The ambulance siren grew closer, and as the automatic doors opened, paramedics pushed in a stretcher carrying a patient. The patient was a man in his late 60s, pale-faced with purple lips. He had suddenly complained of difficulty breathing. Blood pressure 160, pulse 120, respiratory rate 28, oxygen saturation 85%. While listening to the paramedics' report, I immediately put an oxygen mask on the patient. Then I secured an IV line with an 18-gauge IV catheter. The patient, gasping for breath, said he couldn't breathe. Dr. Kenji Tanaka immediately approached the patient and took out his stethoscope. He checked his lung sounds and heart sounds. Then he touched the patient's neck to check for jugular venous distension. He also pressed his legs to check for edema. "We will do an X-ray today." As he instructed, the radiographer quickly brought a mobile X-ray machine. While the X-ray was being taken, I recalled our hospital's standard protocol. 60s male, acute respiratory distress, low oxygen saturation. For these symptoms, it was acute pulmonary edema. I confidently prepared furosemide 40 milligrams. This is the standard first-line medication for patients with acute pulmonary edema. It is a diuretic that removes excess fluid from the body and reduces strain on the lungs. According to what I learned in American nursing, this was the correct course of action. The X-ray results came back. Blurred shadows were visible in the lower lobes of both lungs. It was a typical finding of pulmonary edema. I became even more more convinced. "Doctor, the furosemide is ready," I said with confidence. However, Dr. Kenji Tanaka was still looking at the X-ray film, and he observed the patient again. "Nurse, wait a moment." Kenji Tanaka stopped me. His expression was serious, but his voice remained calm. "Prepare another medication. It's nitroglycerin." I was perplexed. Furosemide was the standard first-line medication for patients with pulmonary edema. It was common knowledge to any American healthcare professional. Moreover, I had seen dozens of such cases in my 3 years, and I had never made a mistake. "Doctor, shouldn't furosemide be administered first for pulmonary edema? The X-ray clearly shows findings of pulmonary edema." My voice was filled with doubt. Honestly, I also felt annoyed. I was confident in the experience and knowledge I had accumulated over 3 years in America, and he was a Japanese doctor. I doubted if he truly understood the American healthcare system. "Look at the patient's condition again. There is no jugular venous distension and no leg edema, and he is complaining of chest pain. This is not simple pulmonary edema." Dr. Kenji Tanaka's voice was calm but firm. However, I shook my head. I was confident in my judgment. What was more important was that I was an American nurse, and I felt my expertise was being disregarded. How many cases like this do you think I've seen? For acute respiratory distress with X-ray findings of pulmonary edema, furosemide is standard. This is the protocol in all American hospitals. I did not let go of the furosemide in my hand. I could feel other nurses watching us. Nurse Sharon looked worried, and Nurse Tom shook his head. In such a situation, I felt my authority would be diminished if I backed down. Dr. Kenji Tanaka said that he was not doubting my experience, but insisted that this patient was different. I countered that this was America, and we should follow American medical standards. As I said that, the atmosphere in the emergency room became cold. Other healthcare professionals were also looking at us. I realized at that moment that I might have been a little too direct, but it was already too late. The patient's condition continued to worsen. His oxygen saturation dropped to 82%, and he began to become disoriented. The patient moaned, saying his chest hurt. I urged him to make a quick decision, saying the patient was in danger. I questioned him about how he would take responsibility if he thought my judgment was wrong. At that moment, Kenji Tanaka said resolutely, "I will take responsibility." Kenji Tanaka took the furosemide from my hand and said he would administer it himself. His gaze changed. Although he was usually quiet and expressionless, at that moment, a strong will could be felt. I was speechless for a moment at his appearance. He went to the medication room and brought back nitroglycerin and other medications. Then he began administering them to the patient. I watched him, feeling angry. I felt that my expertise as an American nurse was being disregarded. However, something astonishing happened. Within 10 minutes of administration, the patient's breathing began to stabilize. His oxygen saturation rose to 95%. The X-ray results showed acute cardiogenic pulmonary edema. If I had administered the furosemide I prepared first, the patient's condition would have worsened further. I was speechless. I didn't want to admit that I was wrong, but the patient was clearly improving. Other healthcare professionals were also impressed by Kenji Tanaka's accurate judgment. Dr. Johnson, a senior colleague at the hospital, approached me and said, "You got lucky, not skill. The patient's life was at stake, so why were you so stubborn?" His words were to the point. I couldn't find any excuses. I vaguely dismissed it as just luck. At that moment, Kenji Tanaka returned after checking on the patient and said quietly, "Would you say it's luck if it were your family?" That one sentence pierced my heart. Although his voice was simple and calm, it contained a sense of responsibility towards the patient and a mission as a healthcare professional. At that moment, I realized how arrogant I had been. Kenji Tanaka said nothing further and headed towards the ward. I stood there stunned, staring at his retreating back. The confidence and pride I had held until then began to crumble. On my way home that night, I kept thinking. I wasn't sure if I was treating the patient or just protecting my own pride. The thought arose that perhaps the education and experience I received in America were not everything. Dr. Kenji Tanaka, a Japanese doctor, appearing before me might have been assigned to re-examine the prejudice and arrogance I held. However, I was not yet ready to fully accept it. It was certain, however, that a small crack had appeared in my heart. After that incident, I found myself inexplicably unable to take my eyes off Kenji Tanaka. At first, it was clearly to find his mistakes. I didn't want to admit the fact that I had been wrong. I thought that if he made a mistake, I could say, it was just luck that time too. On Monday morning, I went to the hospital early and watched Dr. Kenji Tanaka's rounds. He arrived exactly at 7 a.m. and carefully checked each patient's chart. While other doctors mostly looked at summaries prepared by nurses, he read all the test results and progress notes directly. Furthermore, he meticulously checked even the nursing records from the previous night. He read every single observation I had recorded about the patients. While other doctors usually just skimmed the nursing records, he was different. He checked everything, from whether something happened to the patient during the night, to what complaints they had and how much they ate. As I watched him, I thought to myself, he's too meticulous. The first patient was an elderly woman with diabetes in her 70s. Her blood sugar regulation was not going well, and she was hospitalized. An American doctor would have just checked the blood sugar numbers and given instructions for medication adjustment. But Kenji Tanaka was completely different. He held the grandmother's hand directly, took her pulse, and asked her what was bothering her. He asked about the sensation in her toes, whether her vision was okay, and if she was sleeping well at night. Furthermore, he even asked what kind of meals she mainly ate at home, and if her family was doing well. As I watched him, I thought to myself, it's a waste of time. Looking at the chart should be enough. Why does he go so far? However, I was a little surprised to see the grandmother's expression brighten. Most patients know that doctors are busy, so they don't express their discomfort properly, but the grandmother was able to confide in him with ease. The second patient was a young man in his 20s, hospitalized for a traffic accident. He had undergone surgery for a leg fracture and was recovering, but he was worried about his treatment costs due to insurance issues. Generally, doctors focus only on medical treatment, and financial matters are handled by social workers or the administrative department. However, after checking the patient's condition, Kenji Tanaka directly contacted a social worker and inquired about legislation for medical cost support. Then he told the patient, "Don't worry, just focus on your treatment." I found it admirable to see him do that. In American hospitals, doctors rarely concern themselves with patients' financial issues. The most surprising thing was the third patient. A man in his 50s, who appeared to be homeless, was hospitalized with pneumonia. Other healthcare professionals tended to keep a distance when interacting with that patient. He smelled, and his hygiene was not good. Some nurses even disliked being assigned to that patient. However, Kenji Tanaka showed a completely different attitude. He spoke to the patient respectfully and examined him carefully. Every time the patient coughed, he patted his back and brought him water. He even wiped the patient's dirty hands directly. I I couldn't understand it when I saw him do that. It was something I would hesitate to do even with double gloves. The other nurses had similar reactions. However, the patient looked at Kenji Tanaka completely differently. He had an expression as if he were looking at an angel. Something even stranger happened in the afternoon. The cleaning staff suddenly fell ill, and the cleaning of the patient rooms assigned for that day was delayed. Normally, this would be handled the next morning or by additional cleaning staff. However, Kenji Tanaka himself picked up a mop and began cleaning the patient rooms. The nurses tried to stop him, but he said that it was important for patients to receive treatment in a clean environment and continued to clean diligently. I was dumbfounded watching him. A doctor cleaning. It was unimaginable in America. The boundaries of each specialty were clearly defined, and I couldn't understand his actions that crossed those boundaries. However, the patients' reactions were different from what I expected. They were all touched and seemed to trust him even more. The next day was the same. Kenji Tanaka stayed in the intensive care unit until 2 a.m., watching over a critically ill patient. It wasn't his duty, but he voluntarily stayed because the patient's family lived far away and couldn't come at night. Watching him, I became increasingly confused. After a week, I realized I had been observing him to find his mistakes, but when it came down to it, I only saw his perfection. No, human might be a more accurate description than perfect. American doctors emphasize efficiency. The number of patients they have to see per hour and how quickly they have to process tests are important. Their interaction with patients was limited to exchanging necessary information. Robust communication was often seen as unprofessional. However, Kenji Tanaka was the opposite. Even if it took time, he fully focused on each patient, paying attention not only to medical treatment, but also to emotional care. His attitude, which prioritized people over money or honor, posed a great question to me. His interaction with terminally ill patients was particularly impressive. A woman in her 60s was suffering from the side effects of cancer treatment, but other doctors were only focused on medical procedures. However, Kenji Tanaka had long conversations with the patient. He listened to everything: her fear of treatment, her worries about her family, and her plans for the future. Sometimes he sat with her for over 30 minutes. Watching him, I wondered, why does he go to such trouble? He's already fulfilling his duty as a doctor. Why does he try to do more? At first, I simply thought it was a difference in Japanese culture. But as time went on, I realized that wasn't the case. His actions had a consistent philosophy. It was the perspective of seeing patients not just as treatment subjects, but as human beings. Regardless of whether they had money or not, regardless of their social status, he treated all patients with the same heartfelt care. This attitude had a profound impact on me. I had often thought of patients as cases: diabetic patients, hypertensive patients, cancer patients. I approached them in this disease-centric way. However, Kenji Tanaka recognized each person as an individual. 2 weeks into my observation, strange symptoms began to appear in me. I found it difficult to wake up in the morning and felt fatigued all day. At first, I thought it was just stress or overwork. Recently, I had been more nervous than usual trying to observe Kenji Tanaka. However, the symptoms worsened. I experienced indigestion and nausea. I frequently had headaches, and my concentration decreased. I endured it for about a week, and then visited the internal medicine department within the hospital for an examination. The doctor said it seemed like stress-induced indigestion and prescribed digestive medicine. However, my symptoms did not improve even after taking the medicine. In fact, they seemed to be getting worse. and my complexion turned pale. The situation remained the same even after a month. This time, I underwent more detailed examinations at another hospital. I had blood tests, urine tests, and endoscopic examinations, but the results showed no specific abnormalities. The doctor diagnosed it as neurotic enteritis and advised me to manage my stress. However, I felt something was different. The symptoms that couldn't be explained by mere stress continued to appear. Loss of appetite, abdominal bloating, and inexplicable overall weakness. These symptoms persisted and began to affect my work. My colleagues started to worry about my condition. I, who was usually active, had become quiet, and my face had become quite thin. Several colleagues advised me to take a leave of absence and rest fully. I received similar results at a third hospital. All test values were within the normal range, and no specific abnormalities were found. The doctors said that psychological stress seemed to be manifesting as physical symptoms, and even recommended counseling at a psychiatric clinic. However, a specialist in gastrointestinal diseases at a fourth hospital suggested another possibility. They said that my symptoms were similar to the early symptoms of a rare gastrointestinal disorder. More precise examinations were needed for an accurate diagnosis. The results of the additional tests confirmed that I had a very rare gastrointestinal disorder. This disease was extremely rare in America. The incidence rate was about 2 out of 100,000 people, and most doctors had never experienced a real case. The problem was that it was difficult to find a doctor with experience in treating this disease. I inquired at several hospitals, but most of them offered theoretical treatment methods and lacked practical experience. One doctor even suggested going to a larger university hospital. However, by chance, I heard a shocking story from a doctor. This disease is not that rare in Asia, especially in Japan. The annual incidence rate in Japan is about 30 out of 100,000 people, which is more than 10 times higher than in America. And even more surprisingly, our hospital had a doctor who knew this disease well. It was precisely Dr. Kenji Tanaka. He had experienced treating this disease many times in Japan. At that moment, I was overwhelmed with complex emotions. It was ironic that the Japanese doctor I had so ignored was the only person who could cure my illness. My pride was hurt, but at the same time, hope arose. I agonized for several days. Should I really receive treatment from him? Should I ask for help from the person towards whom I had harbored disregard and prejudice? However, my condition was worsening. I couldn't postpone it any longer. I couldn't harm my health because of my pride or prejudice. And honestly, in the past few weeks, I had felt something while observing him. The doubts I had about his abilities as a healthcare professional and his character had largely disappeared. In the end, I decided to visit Kenji Tanaka. I decided to put aside the prejudice and pride I had held until then and ask for his help as a patient. However, a sense of awkwardness remained in the back of my mind. How would he treat me? Would he remember the attitude I had shown him? Such worries raced through my mind, but what was more significant was my health. I couldn't hesitate any longer. The moment I knocked on Dr. Kenji Tanaka's examination room door, my heart pounded violently. The attitude I had shown him flashed through my mind. My disregard, prejudice, and even the confrontation in the emergency room a few days ago. I was afraid of what kind of look he would give me. I heard his voice say, "Please come in," and I slowly opened the door. Dr. Kenji Tanaka was sitting at his desk, looking at patient charts. When I entered, he looked up and saw me, but his expression showed no surprise or awkwardness. He was simply calm as usual. He told me to sit in the chair in front of him. As I sat down cautiously, I wondered how to start the conversation. Considering the attitude I had shown him, I felt I should start with an apology, but my mouth wouldn't open. Kenji Tanaka spoke first. "What symptoms brought you here?" he asked. His voice was professional and warm, just like when he treated any other patient. It was as if he remembered nothing of our past interactions. With a trembling voice, I explained my symptoms. I confessed everything: the persistent fatigue, indigestion, weight loss, and the diagnostic results from other hospitals. After listening to me until the end, he asked a few additional questions. When did the symptoms start? How is your family? What is your usual diet like? I tried to answer as accurately as possible. Still, a part of me remained doubtful, wondering if he would really treat me properly. After listening to all my explanations, Dr. Kenji Tanaka said that a physical examination was necessary. Then he called a nurse and instructed her to bring the examination gown. At that moment, I realized the fact that I would become a patient and have to undress in front of them. When the nurse brought the gown and left, Kenji Tanaka said, "I'll be out for a bit," and left the room. Left alone in the examination room, I began to undress with trembling hands. As a nurse, I had seen countless patients go through this situation, but it felt completely different when I was in that position. It was unbearable to have to show such a helpless side in front of someone I had so ignored. The moment I took off my skirt, tears welled up. Is this what I have to experience? I thought, and my pride crumbled. When I changed into the examination gown and lay down on the bed, Dr. Kenji Tanaka entered again. He checked my condition and then carefully began to palpitate my abdomen. His touch was precise and careful. He meticulously checked which areas were painful and when he touched them. As the abdominal examination progressed, I felt extreme embarrassment. As a nurse, I had guided countless patients to undergo such examinations, but when it came to undergoing it myself, I never thought it would be so humiliating. It was especially embarrassing in front of a Japanese doctor whom I had ignored. The word internal was necessary to explain that a precise diagnosis of the lower abdomen required it. At that moment, I felt truly humiliated. I couldn't accept the reality of having to undergo the most embarrassing examination in front of the person I had so disregarded. However, something strange happened. Dr. Kenji Tanaka was extremely considerate of my discomfort. He explained the examination process in advance and told me to say if it hurt at any time. He also had a female nurse present and made sure I was as relaxed as possible. He repeatedly asked if I was okay during the examination. His touch was that of a pure healthcare professional, without any personal feelings mixed in. He treated me as carefully as if I were a precious patient. If it were me before, I might have been distant or proud in such a situation, but he showed no such attitude at all. Instead, he took care to make me as relaxed as possible. Watching him, I was overcome with complex emotions. After the examination, Kenji Tanaka said that further detailed examinations were necessary. He said that an accurate diagnosis had to be made through blood tests, endoscopy, and computed tomography, and that it would be advisable to receive inpatient treatment for the time being. As I listened to his words, I felt a sense of relief. Finally, I could accurately diagnose my illness and receive treatment. At the same time, I realized how wrong my prejudice against him had been. After completing the admission procedures and lying in the hospital room, I had a thought. I realized the difference between how I treated patients as a nurse and how it felt to be treated as a patient. From the patient's perspective, I realized how precious even the smallest consideration from a healthcare professional The first night was the hardest. I couldn't sleep due to abdominal pain and nausea. Around 1 a.m., when I pressed the nurse call button, it was not the night nurse, but Kenji Tanaka who appeared. He was still at the hospital. When I complained of pain, he immediately said he could prescribe pain medication. However, he suggested trying other methods besides just medication. He explained that abdominal massage and warm compresses might help, and he actually brought a warm towel and placed it on my abdomen. At that moment, I was bewildered. A doctor doing something like this himself was unimaginable in America. However, his natural demeanor gradually put me at ease. The next day, comprehensive examinations began in earnest. Dr. Kenji Tanaka delved deeply into finding the cause of my illness. He asked not only about medical examinations, but also about my lifestyle in detail. He asked what kind of food I mainly ate, how I dealt with stress, whether I exercised, and if I got enough sleep. Furthermore, he asked about illnesses I had in childhood, my family's health status, and recent psychological changes. At first, I wondered why he was asking so many questions, but I later learned that these were important clues to finding the cause of this disease. What surprised me most was his way of making rounds. He came to my room several times a day to check on my condition. 7 a.m., 12 p.m., 6 p.m., and even 9 p.m. While other doctors usually made rounds once a day, he visited very frequently to check on me. And every time he came, he carefully asked if I was uncomfortable or if anywhere hurt. He not only checked my medical condition, but also paid attention to my mood and psychological state. He showed concern about whether the hospital food suited my taste, if I was sleeping well, and how my family was doing. I particularly remember one late night. I was unable to sleep due to abdominal pain, and Kenji Tanaka entered my room. After checking my condition, he brought me a cup of warm tea. He explained that it was a tea made by simmering chamomile and ginger, which is effective for indigestion. He sat next to me while I drank the tea. He just stayed by my side without saying anything. At that moment, I was deeply moved. I couldn't believe that a busy doctor would spend so much time for just one patient. A few days passed, and I was able to observe his interactions with other patients as well. Across the hall from my room was an elderly woman in her 70s who had early symptoms of dementia and would sometimes repeat herself. Other healthcare professionals seemed a bit bothered by that grandmother. However, Kenji Tanaka was different. No matter how many times the grandmother repeated the same story, he patiently listened. He held her hand and spoke to her kindly. It was as if he were treating his own grandmother. Another patient was a young woman in her 20s whose family situation was difficult, and she was very worried about treatment costs. Kenji Tanaka found a treatment method that could reduce her expenses after checking her condition. He also coordinated with social workers to help her receive financial assistance for medical expenses. Even more surprising was his attitude towards a frail elderly man in the intensive care unit. With no family and no medical expenses, other healthcare professionals felt he was a burden. However, Kenji Tanaka treated that old man with the same dedication. In fact, he visited him more frequently to check on him. Watching these scenes, I became increasingly drawn to him. At first, I just thought he was a skilled doctor, but as time went on, I felt something more. It was too early to call it love, but the feelings of respect and admiration were certainly growing. However, what was strange was that he wasn't particularly kind only to me. He treated all other patients the same, and sometimes even more carefully. This gave me another realization. Until now, I had thought of nursing as just a technique or a task. I believe that accurate medication administration, prompt procedures and efficient task processing were the criteria for a good nurse. However, seeing Kenji Tanaka, I realized that true medical care is born from the heart, not from technique. The perspective of seeing patients not just as treatment subjects, but as precious human beings, empathizing with their suffering and wanting to walk with them, and the attitude of providing humanistic care beyond medical treatment, I came to the conclusion that this is true medical care. A week passed, and the precise diagnosis was made. As expected, it was a rare gastrointestinal disorder, and Kenji Tanaka, based on his treatment experience in Japan, devised a specific treatment plan. He said that a comprehensive approach was necessary, including medication, dietary therapy, and lifestyle improvements. His meticulousness continued even during the treatment. He checked daily for medication side effects, whether I was eating properly, and any changes in my condition. He also told me to ask him anytime if I had any questions about the treatment. Watching him, I was ashamed of how narrow-minded I had been. I realized that true professionals are those who do their best for patients, regardless of their nationality or origin. And above all, I couldn't take my eyes off him. First, I was impressed by his skill, and then by his character. Now, those feelings have merged into something deeper. The word love was still unfamiliar, but there was certainly a special feeling. When he entered the room, my heart pounded, and when I heard his voice, I felt a sense of relief. And when I saw him taking care of other patients, I felt even more respect. However, at the same time, I had complex emotions. Considering the attitude I had shown him until now, I felt ashamed. Prejudice, disregard, and even the confrontation in the emergency room. I was also worried if he would be able to forget my behavior. 2 weeks into my hospitalization, my condition improved considerably. Kenji Tanaka's treatment was showing its effects. My pain decreased, and my appetite returned. I also started to gain weight little by little. On the evening of the day before my discharge, Kenji Tanaka came for his final rounds. He checked my condition and explained how to manage it in the future. He said that I would need to have regular outpatient checkups and continue to pay attention to my lifestyle. And finally, he added one more thing. If you have any physical abnormalities in the future, please contact me anytime. Hearing those words, I felt relieved, but also a sense of sadness. I felt a sense of reluctance at the thought that I would no longer be able to see him every day. On the day of my discharge, I expressed my heartfelt gratitude to him. I was grateful not only for curing my illness, but also for giving me many realizations. He smiled calmly and said, "I hope you recover completely soon." After leaving the hospital, I felt that many things had changed. Not only had my body recovered, but my heart had also changed. And my feelings towards Kenji Tanaka had completely changed. He was now not just a fellow doctor, but a special person to me. On my first day back at work after my discharge, I felt that many things had changed. Not only had my body recovered, but my mindset had also completely changed. My perspective on patients had changed, and above all, my feelings towards Kenji Tanaka were completely different from before. However, even though I had changed, the people around me had not necessarily changed. Rather, I felt stares that seemed to question my change, especially after the fact that I had received treatment from Kenji Tanaka during my hospitalization became known. At first, it was just curiosity. Colleagues worried about my health and asked what kind of treatment I had received. I honestly told them that Kenji Tanaka was in charge. At that time, there was no particular reaction. The problem started after that. more specific and malicious content. I happened to overhear colleagues whispering at the nurse's station. They used expressions like, "an American nurse who lost her heart to an Asian doctor." There were also stories about falling in love while receiving treatment. Every time I heard such words, my face turned red. What was even more shocking was the fact that among the people spreading such rumors were colleagues with whom I usually got along well. Nurse Sharon didn't say anything to me directly, but she told others that I was infatuated with the Japanese doctor. What was most ironic was that these prejudiced remarks were the same ones I had used before. My past long-standing disdain for Asian healthcare professionals, my cultural superiority complex, my occasional dismissive remarks, all of them were now directed at me. Nurse Tom jokingly said, "It must be nice to date a doctor. You'll get easier assignments for good cases." Every time I heard such words, I felt angry, but at the same time, I felt ashamed. It was exactly the same words I had said to others before. The patients' reactions also changed. Some patients began to look at me strangely, especially among the elderly white patients. Some showed blatant displeasure. One old man even demanded to be changed to another nurse. At first, I couldn't stand this situation. I was frustrated as to why I had to receive such stares. I was just a patient receiving treatment, but I felt like I had done something wrong. However, after a few days, I began to accept this situation in a different way. I realized that this was the result of what I had done to others. The prejudice and disregard I had shown towards Asian healthcare professionals, they had now returned to me. And most importantly, the fact that I was no longer the same Marison. What I had learned through Dr. Kenji Tanaka, what I had experienced as a patient, had completely changed me. Now, I wanted to fight against such prejudice. Instead of arguing or making excuses, I decided to act quietly. I learned the way Kenji Tanaka interacted with patients and began to apply it to my work. He treated patients not just as treatment subjects, but as people living together. The first thing that changed was how I greeted my patients. Previously, I only said what was necessary in a businesslike manner, but now I sincerely inquired about their well-being. I became interested in how they were feeling, if they slept well at night, and if their families were doing well. I made a special effort to pay attention to patients I had previously avoided. When a homeless patient was admitted, the old me would have had minimal contact, but now it was different. I took extreme care not to make him uncomfortable and took care of him wholeheartedly, just like any other patient. At first, it was awkward. I was conscious of my colleagues' stares, and the patients also seemed to be questioning my change. However, as time went on, the patients' reactions began to change. When I interacted with them wholeheartedly, they also opened up to me. The most memorable was an elderly woman with diabetes in her 70s. When she was first admitted, she was a very difficult person. She complained about everything to the nurses and got upset over trivial matters. Other nurses avoided that grandmother. However, I approached her with the memory of how Dr. Kenji Tanaka treated his patients. I truly listened to why she was angry and what was bothering her. When I listened to her story, I learned that she lived alone and was acting that way out of fear of being sick. After I listened to her story until the end and comforted her by saying, "Don't worry," she changed completely. After that, whenever she saw me, she would smile brightly and tell me stories about her grandchildren and her youth. It was so much so that other nurses were surprised by the change. As these changes accumulated, the stares of my colleagues also began to change little by little. Although rumors about me and Kenji Tanaka continued to circulate, there was an atmosphere of acknowledgement regarding my work attitude. Patients patient satisfaction also visibly improved. About a month later, I had an opportunity to meet Dr. Kenji Tanaka. We ran into each other in the hallway, and as he looked at me and nodded, he said, "You've changed a lot recently." He said he had heard that my reputation among patients had improved. Hearing those words, I was truly happy. The fact that he acknowledged my efforts was more precious than anything else. For the first time, I smiled brightly at him and honestly said, "It's thanks to you." However, his next words moved me even more. "I hope that the heart you have for interacting with patients is not because of me." I didn't understand the meaning of those words at first, but after thinking about it carefully, they had a deep meaning. He didn't want me to change because I liked him, but he genuinely wanted me to change for the sake of the patients. It was his attitude of prioritizing professional spirit over personal feelings, and his attitude made me even more attracted to him. At that moment, I realized the feelings I had for him were not just a fleeting crush. Respect had grown before the feeling of love. His character, his philosophy, his way of interacting with patients, all of it had changed me. However, at the same time, I felt a sense of distance from him. He always tried to maintain a professional relationship. I could feel his belief in not letting personal feelings interfere with his work, and his attitude seemed even more attractive. The rumors within the hospital continued. Some colleagues whispered that I was acting consciously towards Kenji Tanaka. However, I decided not to pay attention to such remarks anymore. Regardless of the reason for my change, the result was that I was providing better care to patients. Instead, I began to actively confront such prejudice. When colleagues made negative remarks about Asian doctors, I quietly retorted, "They should be judged by their abilities. Their origin and nationality are not important." At first, my colleagues looked at me strangely. It was because I was completely different from the previous Marison. But as time went on, some colleagues began to empathize with my words. Especially among the younger nurses, some began to support me. The biggest change occurred within myself. Previously, my pride as an American nurse led directly to a sense of superiority over others. But now, I began to use that pride in a more constructive direction. I strived to become a truly skilled nurse. I learned a lot by observing Dr. Kenji Tanaka's rounds. I carefully watched how he communicated with patients and how he provided care. And I tried to apply those methods to my work. In particular, I tried to learn his meticulousness. It was his approach of understanding the characteristics of each patient and providing customized nursing care. Instead of just following the manual, he considered the individual circumstances of the patient. For example, even for diabetic patients, I varied my approach depending on their age, family situation, and financial condition. I emphasized the importance of disease management to younger patients, and for elderly patients, I presented practical management methods rather than lifestyle improvements. As these changes accumulated, my job satisfaction also greatly improved. Previously, my goal was simply to finish the work, but now I worked with the wish that each patient would be even a little more comfortable. The patients' reactions also changed surprisingly. The recovery rate of my patients accelerated, and their hospital stays decreased. I also received good scores in patient satisfaction surveys. As these results came out, my colleagues also began to acknowledge my change. However, some colleagues still believed that I changed because of Kenji Tanaka. They saw my change in work attitude as being due to personal feelings. While such stares were sometimes burdensome, I decided to continue on my path. One day, I had an opportunity to handle an emergency situation with Dr. Kenji Tanaka. A patient in cardiac arrest was brought in, and we performed emergency procedures together. He seemed surprised by my changed demeanor at that time. If it were the old me, it would have been difficult to follow his instructions due to pride, but now I cooperated naturally. The most important thing was to save the patient, and we showed perfect teamwork. As a result, we were able to successfully resuscitate the patient. After that, Dr. Kenji Tanaka said to me, "You've really grown a lot. You are now the image of a true healthcare professional." You cannot imagine how happy I was to hear those words. Being recognized by him was more precious than anything else. From that day on, I was convinced. The feelings I had were not just a fleeting crush or a temporary emotion. The respect and admiration for Kenji Tanaka and the satisfaction with myself growing through him all combined to develop into a special emotion. However, I still hesitated to call that emotion love. Love is established in a relationship with another person, but Kenji Tanaka still maintained a professional distance. So, for the time being, I decided to organize these feelings as respect and admiration. Instead, I decided to continue learning from him and growing. I wanted to become a healthcare professional of the same caliber as him someday. And I harbored the hope that when that time came, our relationship might develop into a true colleague relationship, or even more. And so, I continued on my path without being discouraged by the prejudice and rumors within the hospital. I was on a journey of following the path that Kenji Tanaka had shown me, while simultaneously creating my own unique color. And in that process, I learned what a true healthcare professional is and how I should interact with patients. About a year passed, and then I received unexpected news from Kenji Tanaka. He was going to return to Japan. He said he had been invited to participate in a new medical project in Japan due to family circumstances. Hearing that news, I felt as if the sky had fallen. In the past year, I had grown significantly as a healthcare professional while working with him. It would not be an exaggeration to say that I had been reborn as a completely new person influenced by him. And now, he was leaving. I was at a loss as to what to do from now on. However, at the same time, I realized the feelings I had for him went beyond mere collegiality or admiration. The fact that my heart ached so much at the thought of him leaving was clear evidence of a special emotion. I agonized for several days. What choice should I make? Should I stay and continue the career I had built so far, or should I try a completely new challenge? I thought about many things until I reached a conclusion. Finally, I mustered up the courage and confessed my feelings to Kenji Tanaka. I told him I wanted to go to Japan with him. I wanted to start anew there. Of course, I was afraid, but the desire to be with him was greater. Kenji Tanaka seemed surprised to hear my words. He worried that life in Japan would not be easy. He said that there would be many difficulties due to language and cultural differences, but I replied that I had made up my mind, and so I made the biggest decision of my life, to leave my stable life in America and go to Japan. My family and friends were all dismayed. They tried to stop me, asking why I would take such an adventure, but I was convinced this was the most important choice of my life. I wanted to experience a wider world as a true healthcare professional, not just to follow Dr. Kenji Tanaka. On the day I boarded the plane to Japan, I had complex feelings of tension and anticipation. A new country, a new culture, a new language. Everything was a challenge. But I also felt anticipation that I would grow further through those challenges. From the first day I arrived in Japan, it was a series of shocks. First, the language barrier was much higher than I had anticipated. Kenji Tanaka translated for me, but there were limits to communicating directly with patients. Learning Japanese was a top priority, so I started studying Japanese intensively. I took private lessons and participated in language exchange programs. Medical terminology was particularly difficult, but Kenji Tanaka helped me a lot. We studied together late into the night, memorizing things one by one. The Japanese healthcare system was also completely different from America's. It was a rapid and accurate system, and in terms of efficiency, it even had many superior aspects compared to America. Patient waiting times were short, and consultation hours were reasonable. What particularly surprised me was the relationship between patients and their families. In America, individual autonomy is emphasized, but in Japan, the entire family actively participates in the treatment process. It took time to understand these cultural differences, but I gradually discovered their strengths. The culture that emphasizes emotional care shocked me again. The relationship between healthcare professionals and patients was much more humanistic than in America. They valued patients' emotions and psychological states and considered these factors in the treatment process. The first few months were really tough. I made many mistakes due to language difficulties and not being accustomed to the culture. Misunderstandings occurred due to my inability to communicate well with patients, and there were situations where I inadvertently violated Japanese medical customs. However, I did not give up. With the help and encouragement of Dr. Kenji Tanaka and the kind support of my Japanese colleagues, I gradually adapted. In particular, the nurses warmly welcomed me, which was a great source of strength. After about 6 months, I was finally able to have basic conversations with patients in Japanese. The process was truly arduous. Every night, I pored over Japanese textbooks, memorized medical terms, and practiced pronunciation repeatedly. The time Kenji Tanaka spent teaching me late into the night, explaining things one by one, was the most precious. I still vividly remember the first time I checked a patient's condition in Japanese and offered words of comfort. It was an elderly woman in her 70s who was depressed because her recovery after knee surgery was slow. I spoke to her in Japanese with a trembling voice. "It must be painful, but you will get better little by little. We will help you until the end." The grandmother suddenly smiled brightly when she heard my clumsy Japanese. Then she squeezed my hand and said, "Thank you." You cannot imagine how deeply moved I was that a doctor from a foreign country had learned Japanese to speak to her. You cannot imagine how happy I was at that moment. I was on the verge of tears. From that day on, my Japanese improved rapidly. The desperate desire to communicate with patients became the best motivation. I tried to learn warm words that could heal patients' hearts before difficult medical terms. As my language skills improved, I also came to better understand the depth of Japanese medical culture. The concept of caring for patients like family was truly impressive. In America, privacy was emphasized and distance was often maintained. But in Japan, a true family-like bond was formed between healthcare professionals and patients. Especially the elderly patients treated me like their grandchild. When they heard that I was having trouble adapting to Japan for the first time, they worried about me and encouraged me instead. Such warmth was something I had never experienced in America. The meticulous consideration seen in the treatment process was also astonishing. They not only provided medical treatment, but also considered patients' emotional states and family relationships when approaching them. For example, if a patient was about to undergo surgery, they would set aside ample time for consultation with the family to alleviate their anxiety. The strong cooperative relationship among healthcare professionals was also impressive. In America, each specialty was clearly defined, relationships were mostly professional, but in Japan, they truly helped each other like a single team. The relationship between seniors and juniors was both strict and warm, and if there were difficulties, everyone worked together to help. All of this was a new learning experience for me. I further realized that medicine is not just a technical field, but an area where human relationships and emotional empathy are important. I also learned that the attitude Kenji Tanaka showed in America was actually born from Japanese medical culture. My relationship with Kenji Tanaka also deepened during this process. Initially, it was a professional partnership, but now it was becoming a true life partnership. His consideration and support during my adaptation to life in Japan were truly invaluable. He was my teacher when I was learning the language. He patiently corrected my pronunciation when it was different, and when I struggled to memorize medical terms, he found interesting ways to help me. Sometimes, while studying late into the night, we got to know more about each other. He shared stories from his childhood, the reasons he decided to become a doctor, and even the difficulties he experienced in America. As we shared personal stories, we became more than just colleagues, developing a special relationship. I also honestly confessed my past stories, including the embarrassing memories of when I harbored prejudice. In the process of overcoming difficulties together and understanding each other, a special bond was formed. When I made a mistake in communicating with patients, he encouraged me, and conversely, when he faced difficulties adapting after returning to Japan, I could comfort him. We reached a point where we could even show each other our vulnerabilities. I particularly remember the first day I explained a surgery in Japanese. It was a simple surgery, but I was very nervous explaining it directly to the patient. Dr. Kenji Tanaka watched from beside me and encouraged me, and when I finished the explanation successfully, I saw him looking at me with a genuinely proud expression. At that moment, I clearly felt that he was not just a colleague, but someone who genuinely supported my growth. As the seasons changed and about a year passed, we confirmed our feelings for each other. One spring evening, on our way home from the hospital together, he initiated the conversation. He cautiously confessed that the feelings he had while working with me seemed to go beyond mere collegiality or friendship. I replied that I felt the same way. I said that the respect and admiration that began in America had developed into true love through life in Japan. That night, we talked for a long time. We confirmed our feelings for each other and seriously discussed our future. And naturally, we decided to get married. Our shared dreams, our common goal of contributing to the local community, and our desire to become better people through each other. Everything matched perfectly. The wedding preparations were also special. We decided to incorporate traditions from both Japan and America. It was not easy to respect and harmonize two cultures, but in the process, we came to understand each other's cultures more deeply. First, we had a traditional Japanese wedding. The experience of wearing a kimono and performing traditional rituals was truly wondrous and moving. It became even more meaningful because Kenji Tanaka's family warmly welcomed me. Experiencing Japanese culture firsthand, I re-examined the meaning of family and the value of marriage. And a few months later, we had a Western-style wedding ceremony in America. I was truly proud to introduce Kenji Tanaka to my family and friends who had gathered. Although my family initially couldn't understand my choice, they completely opened their hearts after meeting him in person. It was a special wedding where two cultures harmoniously blended. The elegance of Japan and the freedom of America merged, creating a truly beautiful story. That day, I was convinced. With this person, I could joyfully accept any challenge. After getting married, we decided to open a small clinic in a residential area on the outskirts of Tokyo. Working in a large hospital would have been good, but we shared a common dream of practicing medicine while communicating more closely with the local residents. The process of preparing the clinic was not easy either. Understanding Japanese medical laws, obtaining necessary permits, and equipping the facility were all complex processes. But I was confident that I could overcome any difficulty with Kenji Tanaka. In particular, due to my background as an American nurse, additional procedures were required. To practice medicine in Japan, I had to go through the process of obtaining a license. It was difficult, but it was worth enduring for the sake of my dream. When we finally opened the clinic doors, we were truly thrilled. It was a small space, but it was a place where we could imbue our own philosophy and values. The sign read, "Operated by a couple, an American nurse practitioner and a Japanese doctor." Initially, we didn't have many patients. There was suspicion towards foreign doctors, and being a small clinic also had its limitations. However, we persevered and treated each patient wholeheartedly. As time went on, word of mouth began to spread. We were nicknamed the Warm Clinic and became an essential space, especially for multicultural families and foreign workers. I was able to be of great help to those who had difficulty communicating in Japanese. There was a Vietnamese woman who was a marriage immigrant who came with her child. She had trouble receiving proper medical care at other hospitals because she was not proficient in Japanese. I was able to communicate with her in English and have a detailed consultation. The same was true for a caregiver from the Philippines. Seeing her struggling to understand complex medical terms, I explained them in gentle words. Seeing her gratitude, I reaffirmed the reason I do this work. Through these experiences, I came to understand the true meaning of medical care more deeply. I realized how important communication and understanding between people are, not just curing diseases. My diverse cultural background was greatly helpful in this work. About a year after the clinic became stable, we received special news. I was pregnant. You cannot imagine how exciting it was to conceive a new life in Japan. I continued to work at the clinic even during my pregnancy. Of course, within my limits, but I couldn't stop caring for patients. Rather, the fact that I was carrying a life made me feel even more attached to the patients. My experience of giving birth in Japan was also special. A culture of care different from America, meticulous family attention, and blessings for the new life. All of these were new cultural experiences for me. Finally, in the spring, our first child was born. It was a healthy baby boy. We agonized over choosing his name. We wanted a name that could incorporate meanings from both Japanese and American cultures. In the end, we chose the name Kaito. It used the kanji for hope, she, and common difference, do. We put in the wish that he would live strongly without losing hope in any difficulty. At the same time, it was a name that could be naturally called in both cultural spheres. Holding my child and standing in front of the clinic, I felt a sense of profound emotion. Looking at my son under the clinic sign, I reflected on the journey I had taken. The entire process, from being a nurse full of prejudice in America to being reborn as a true healthcare professional in Japan, flashed before my eyes like a movie. At that moment, I had an important realization. I realized that I had changed not just for love, but for respect. My respect for Dr. Kenji Tanaka changed me, and that change led to true love. And now, I finally felt like I had become a true nurse. While I was technically skilled before, I became a true nurse who cares for patients with her heart only after coming to Japan. No, it should be cares for people. As Kaido grew, our clinic continued to develop. We gained the trust of the local residents, and more patients began to visit. It became an essential and important space, especially for multicultural families and foreigners. I hoped that my son would grow up and be proud of this clinic. I wanted him to understand the feelings of his mother and father when they cared for people, and that medicine is not just a profession, but a mission. And so, I began a completely new life in Japan, from nurse to doctor, from American to Japanese wife, and to the mother of one child. All the changes were not easy, but in the process, I found true happiness. The new life I am building with Kenji Tanaka, the family time with Kaido, and the fulfillment I feel while caring for patients. All of these are invaluable to me. I have never regretted giving up my successful career in America. Rather, I believe that my current happiness was made possible by the decision I made then. It was an opportunity to grow as a true healthcare professional and as a person. I intend to continue on this path, while hoping that the world Kaido will see as he grows up will be a warmer and more inclusive place. My husband and I will continue to dedicate ourselves to caring for people. That is the way of life we have chosen, and it is a belief that will not